Hello, everyone. My name is Melanie. I am going to be your moderator for this webinar, this wonderful webinar that we're going to be hearing from some really knowledgeable people. We're going to be hearing from Representative Marvin Lim, Scott Thropp, Dr. Tilwinger. And we will just really dig in here and go through some slides and PowerPoint presentations. And then at the end, there will be a Q&A. This is also being live streamed on Facebook and YouTube. So if you go later and you want to rewatch it or you want to share it with your friends, you will be able to do that. But yeah, we will just get started here. If you have any questions, please save them for the end. I promise we will get into them. You can also put them in the Q&A at the bottom of your Zoom screen. Just know that we will get to them, but hopefully you submitted them ahead of time. We have quite a few, so we will tackle those first. All right. So I'm just going to get started here. Welcome to the Power of Your Voice, Shaping Healthcare at Every Level. Like I said, we're going to hear from Representative Marvin Lim first, and I will let him go ahead and introduce himself here.
Thanks, Melanie. I am very happy to be with you all today. I am Marvin Lim. I am a state representative. I represent Gwinnett County, specifically unincorporated Norcross, but I actually grew up in DeKalb County. I started at Dresden Elementary, then Evansdale Elementary, Henderson Middle School the first year. DeKalb County Public Schools had middle schools, and I graduated from Lakeside. And I'm very happy to be able to talk about shaping healthcare at every level per the title. And my goal for my part of this webinar is to certainly inform, but also motivate you all in a way where you can see that there's a lot going on right now and that there are actually many possible ways that you can use your individual voice and hopefully collectively as the CAB Dems with others to shape healthcare literally at every level and branch of government. And I think that actually provides a great way to think about this. Melanie, if you'll go to the next slide.
Mhm.
So I am joined by some learned healthcare folks. I'm not a healthcare expert. I am a policy wonk as well as an attorney. So when thinking about how to present this, I was thinking of, well, how does healthcare actually play out both in the public sphere and the private sphere? First, I wanted to address healthcare in the governmental sphere. So I thought it was helpful to think through, well, how does healthcare play out at the federal, state, and local level? And then how does it play out in the legislative, executive, and judicial branch? Because there are those three branches at pretty much every level of government. And hopefully through the examples, you'll see how healthcare is happening at every one of these levels, and you'll find ways to think through how you can inject your voice. So next point, I suppose. So this one's pretty obvious. At the federal level, with the big bill, we have seen Medicaid and SNAP cuts. I think that one, again, is pretty obvious. So let's move to the next one. So here, obviously, I'm in the state legislature, and I wanted to talk a little bit more, given that that is certainly my lane, about all of the ways that healthcare in the last few years has been at issue. And I did also want to say that obviously these levels of government are meant to intersect with each other. That does not always happen in a way that is productive, but there you go. So obviously the big question, the big push among Democrats in particular for over the last 10 years has really been Medicaid expansion. We know that reproductive health is a big one. I specifically put in there, given the recent jumping ahead to the judicial branch, the Supreme Court opinion allowing states to deny funding of Medicaid funding of Planned Parenthood. I think that is going to be an open question as to whether either the legislature or if the governor decides that he can do that by himself. That's going to be an open question for us. Obviously, gun violence prevention is a public health issue. There have been many questions around insurance, and there is a huge looming question of funding. And again, there's another way that all of this really intersects. I was very fortunate with Representative Karen Lupton, who is DeKalb, Chamblee, to host this past summer a series of press conferences on all of these federal grant cuts and how they're impacting us, certainly at the local level, but also at the state level. And it was interesting that in our analysis, well, really, it was the Center for American Progress's analysis, half of the $2.7 billion grant cuts that were tracked at that time, half of those were actually to state level entities. So the state government or institutions of higher learning, the public institutions of higher learning either in the university system of Georgia or the technical college system of Georgia. So that's going to obviously be a huge question into which we will certainly need to continue injecting our voices. Once school starts, will be an inflection point, and certainly into next year. Um, let's go move to the local. And this was really important to me because I did want to give specific examples because if you look often at the federal and state landscape, even if the Democrats are in control, you think, well, how can I move this, right? And we want to empower you again to shape these conversations at every level. But obviously, with the local level, there are fewer people, and therefore, by the numbers, generally easier to influence that. And again, that really comes to funding. I think this is very, very important not to forget. Do you know where the DeKalb County government is spending their HUD dollars? Do you know where the DeKalb County Board of Public Health is spending their dollars? Some successes that we've had that I was very proud to work with is we restored indigent medical care funding in Gwinnett County. We are not part of the Fulton DeKalb Hospital Authority. And we have a fraction, we actually, for a period of time, we had zero indigent medical care funding. So we worked really hard to restore that. And it was restored in 2022. And then also with respect to maternal health, that's something that I worked very hard with Healthy Mothers, Healthy Babies to find HUD Community Development Block Grant funding. Again, flowing from the federal grant all the way, in this case, all the way to the local level because Gwinnett is large enough that it's called an entitlement jurisdiction. So there are some positive things that we can push, particularly at the policy at that level. And then that's not just funding, obviously. Funding is a type of policy, but something that we're working very hard on right now is comprehensive sex ed. We do not yet have that in GCPS, Gwinnett County Public Schools, unlike in DeKalb County Public Schools. That's going to be a big topic of conversation because the school board, if hopefully you already knew, but if you didn't, that is its own local governmental entity with its own board of education, et cetera. And then something that we were also very proud to work on is ARPA is the American Rescue Plan Act under the Biden administration. I and a couple other people worked really hard to ensure that the requirements that the commissioner set forth for who got that funding would serve undocumented people because during the CARES Act that was administered during and slightly after the Trump administration, that was certainly not happening, certainly in Gwinnett. So those are, again, some really, all of those in the local bucket are really positive examples, 3 out of the 4 of which we have been able to achieve. And hopefully that gives you, again, some examples to think through. So then let's move to the executive branch. Okay, so we go back to funding. That is obviously going to continue to be a theme. We know that there are many federal programs right now, and while they have been allocated, obligated by Congress, we have seen obviously this year the Trump administration take very, very severe steps to essentially take over congressional authority and say, we're going to cut these funds. I had the misfortune through my nonprofit to get 20 million and $400,000 of our 2 biggest grants, federal grants cut from the EPA and the Department of Justice. And that was done because, again, not the legislature, the executive branch took that. So that is the inflection point there. And of course, at the policy level, I wanted to say TANF, but this is actually a positive example. That's the temporary assistance for needy families, something that I and certainly others nationally were very successful at, were ensuring that funding for they're fake clinics, anti-abortion crisis pregnancy centers, that those that were receiving TANF dollars could not be a crisis pregnancy center. So that was, I actually need to check on the status of that rule, but that was a rule that was injected right as the Biden administration was ending. And again, that is something that, oftentimes when you think of federal level lawmaking, you're not thinking of executive rulemaking. You might be thinking about the funding, but we don't realize that every single agency sets their own rules and regulations, and there's a lot going on there that is very bureaucratic, but very much matters into how we live our lives. So there are many ways to inject our thoughts, beliefs, opinions on that as well. So next. Yeah, so the state executive, which is led by Governor Kemp. While the legislature, we are in a democratic republic, the legislature is the most responsive. If you look at the state budget every year, my Republican colleague and I, Representative Gunter and I calculated this one sine die, 99.5% of the budget goes to the executive branch. The rest goes to the judicial and the legislative branch in the state level of government. So as you can imagine, we have a very strong executive branch in terms of both the funding and the authority. There are certain steps that have been taken in previous administrations to cut that. Medicaid expansion has to be approved by the legislature, for example. But for the governor to do it, and I think that's why there's the open question regarding Medicaid funding of Planned Parenthood and his authority to do that by itself. But anyway, all of that is to say that the governor and all of these executive branches control a lot. When we go back to the American Rescue Plan Act, most of that money went straight to the state, and you had to plea your case to the state as to whether your project, public or private, deserved it or not. And then in terms of policy, again, we've seen that with COVID. Most of that, yes, we did some of that in the state legislature for sure, but most of that, a lot of that was set in our Department of Public Health, which is headed by Dr. Catherine Toomey. Again, Medicaid funding of Planned Parenthood. And it was very interesting. Just this past week, we learned that Dr. Toomey did not apply for, and DPH did not apply for tobacco funding that would have been, it's called formula funding, meaning that the state was guaranteed $2.1 million of it. And they chose not to apply. The reasoning was that, well, that's just going to get cut in a year anyway. But I think that in and of itself, in a state where tobacco addiction and just tobacco in general, including vaping, are such huge public health crises, means, again, how are we using our voices to influence that type of process, which often for especially the executive branch means paying attention to things that are not often in the news, because that was not heavily publicized. Some of this does have public notice requirements. So that can be another place that you might want to look about what's happening at the executive branch. And finally, I want to put as much success as possible. I was really successful in rulemaking. The CJCC is the Criminal Justice Coordinating Council. It's really hard to pass a bill in the state of Georgia. I've introduced over 100 bills. I've gotten exactly one into law signed by the governor. But where we can, we pivot. So I had a bill that was essentially to ensure that those who are survivors of domestic violence and sexual assault, that they did not have to pay for health care using their insurance, even if they were not the direct named insurer, even if they were under someone else's plan, right? Because in the state of Georgia before this, in order to qualify for public victims funds, you had to prove that you didn't have insurance, or that, or actually that was it. So if you had insurance, even if you weren't the primary payer, you could not use those funds, even though we know that for reasons of privacy, or often that who is the primary insured are the abusers themselves, that was something that was really important. We'd seen that as a trend. So we were very successful. This was 2 years ago now, because of through an effort that I led to have that rule changed at the executive level. And then finally, the executives of our local branches of government. Yeah, Health and Human Services is a big one. And I did want to specifically call out when we're talking about health. our local health departments and for you all, the Fulton DeKalb Hospital Authority. There's a lot that can be done at that level. Something that actually we're fighting right now is, and this is kind of quasi-legislative, quasi-executive, because our essentially the executive branch of our county, our planning and development department, they take the first crack at administering, again, HUD, housing and urban development, community development block grant funding. A few years ago, I'd found out that they were using those funds to fund these fake clinics or crisis pregnancy centers. We stopped it for a little bit for whatever reason. The county staff recommended this to the commissioners this year. So we actually have a huge battle right now there to ensure that that doesn't get funded. So if you're an OB, especially regardless of where you are, maybe think of calling in. But then, and finally, opioid overdose prevention. This is a huge thing because the largest, you may know about the opioid settlements and you know that there's an opioid crisis. The largest pots of money or sorry, the largest counties and jurisdictions locally have their own pots of money. They don't have to go just to the state for that. DeKalb is one of those. How is that money being used? Is it being used for medication assisted treatment? Is it being used for Narcan? Is it being used for education? Those are things that we don't often think of as inflection points or injection points, but I think, or I would invite you to think about as something that you would do. And then we can go quickly through the judicial. Obviously, Dobbs, Affordable Care Act, transgender rights, especially those last two. We saw cases in the positive, the Supreme Court upholding the ability or the continued coverage of the ACA of preventive care, which I make very good use of every year. I always make sure with my doctor, is this ACA covered? And then transgender rights. Unfortunately, that was a negative. Moving to the state judicial, though, because we often think of the Supreme Court, SCOTUS, right? But obviously, in this state, we've seen litigated the 6-week abortion ban. That has been very, very important. And while we do not necessarily, I mean, in a perfect world, we do not influence our judiciary in super partisan ways. Remember that our judges are elected. Oftentimes, they're at the state level appointed to the Supreme Court or Court of Appeals, and they just through incumbency get elected, on and on and on. John Barrow got super close, but still not. So, and we know we're not in a perfect world. So public opinion can and does matter. And we have elected judges. So again, that's another point of inflection. And then finally, the judicial level at the local. Yes, I see you, Melanie. This is very, very interesting. I had to think for a minute about what this was, and this is one where I think you can actually play a role. I did want to mention the certificate of need litigation happens. That starts at the local level. Well, as does all litigation, really. But that one has been very interesting to see who gets essentially hospitals and not. If you build a hospital here, does then another hospital fail to survive? Do they get raided? All of these things are litigation that we're not really paying attention to, but that really matter. Oftentimes in the state legislature, I will impugn all of my colleagues, including myself. We think of a great idea, but we don't think of implementation and we don't think of disputes around that. So I did want to use that as an example, but I think more to what might be accessible. Environmental health is health and public health, and litigation on housing conditions is a really critical portion in my mind of healthcare. I mentioned that I am an attorney. Most of my pro bono cases are landlord tenant cases, and most of them are not eviction cases. Most of them are habitability cases. These are important too because you may know that the state legislature just this past year passed HB 404, the Safe at Home Act, which somewhat increased the standards that apartments must meet to be livable, but that is still to be litigated exactly what that looks like. So that is something that I consider part of my advocacy is I'm always on the lookout for possible plaintiffs. Even if I weren't a lawyer, like that is something we could do to refer people to Atlanta Legal Aid, Atlanta Volunteer Lawyers Foundation, etc. So before we move quickly to the next slide, I just wanted to see, hopefully you can see from this that there are those points at all of these levels of government. But that's the government, right? Then moving on to the next and final slide. There's community action. I spent most of my time talking about the government, but really most of my ability to do work has been at the local level. I mentioned that I have a nonprofit. Through that, we get HHS funds to do dementia respite care that's granted through the Alzheimer's Association. Community health work is huge, especially in underserved communities that have low trust or low insurance. They're not necessarily going to go to their primary care provider or their pediatrician. Even if there are like low cost clinics, charity clinics, or what are called federally qualified health centers, right? So what are we doing in the community? Something that we did there this past year is we did monthly blood pressure screenings in 10 different sites in my district because we knew that without that, people probably wouldn't be able to be identified for hypertension until it was too late. I mentioned again opioid overdose prevention. That's something that you don't even need funds to do. We've been doing a lot of Narcan test strip and just opioid overdose trainings with Guide, GNR Health, et cetera. And then finally, organizing. I will say through the course of either my nonprofit or my constituent services, we provide a variety of different navigational services in terms of how do you access Medicaid? How do you access SNAP? How do you access these benefits? How do you access financial assistance programs when you've been handed this bill for even more complex cases? Veterans affair cases or those that need SSDI or SSI, usually refer those out. But that through that, I am reminded over and over again that the number one flaw of government is not only the bureaucracy we create, but our failure to respond to it. And I, I think Representative Lupton, even though she's not right, she said this many times, help isn't coming. And the best thing that we can do for our, at least our individual communities, is to organize ourselves to be able to provide that kind of work. Now, if you're in a higher income or more affluent community, that doesn't necessarily mean that A, people aren't suffering in your community, but also B, how can we extend that out? How can we use our strengths and expertise to go to the communities, first listen to what they might need, and then respond to that to say, this is what we can do. I'll also say, and I'll close by saying this is my theory of change, that when you have to meet people where they are, that includes meeting them in terms of healthcare about what their experiences are and oftentimes problem solving through that. Um, that is really important, more important than me going to someone's door that I don't know and starting to talk about Medicaid. I'm not saying that doesn't work in some, even a lot of instances, but particularly for communities like mine, which are 87% minority and 43% of people don't have health insurance, really meet people where they are. And that's why I constantly do these constituent services. Finally, of course, supporting nonprofits is critical. Hopefully, I ingrained in you all enough how much funding at every level of government is going to nonprofits doing healthcare, and supporting them, especially in this coming year, is going to be very, very important. Because if the federal government isn't funding certain things, who is going to step up to do that? A large part of my fear, we don't need to get into this, is that private equity will take over more of healthcare, which will increase costs more and more and more and more. So we really do need to push, in my strong opinion, and I would imagine yours, our local levels of government, our state levels of government, our school nurses, et cetera, to fund or at least provide these services as much as possible. And decisions are going to have to be made because of the limited resources and what gets funded, and you can have a say in that. And finally, again, I alluded this earlier, the small barriers to entry. For many people, healthcare, there is a huge barrier to entry, not only getting insurance, going to their doctor, even if they have a doctor, and certainly if they need further diagnosis, treatment, respite. Those are all huge barriers. But I think they all start with education because so much of the inefficiency in government is there is actually a resource that exists. We can't get it to the people for whom it's intended, who most need it. And that's where, above anything else, even above policy, that's where you kind of come in to bring those positive things about healthcare resources that exist to people and then ask them as well what their lived experience are with healthcare. And I think that's how we ultimately shape healthcare at every level. The end.
Amazing. Amazing. Thank you so much, Representative Lemon. And speaking of doing those specific things and asking those questions and going into the community like you have, we have another wonderful speaker now, Scott, who's going to tell us about how he's really done that as well.
Hey everybody, so I'm Scott Thorpe, and I'm the Executive Director for the Southern Alliance for Public Health Leadership. We are a very new nonprofit, and you can click over to the next slide. And it is worth mentioning at the outset that we're, as a C3 nonprofit, completely nonpartisan, and that's obviously kind of an essential part of our work. We really have to work across the aisle to do this work and to do it effectively. But what we do, and oh, can we go back
Oh,
for
sorry. Yep.
a sec? Thanks. So what we do is we really give public health professionals and organizations the tools, training, and support they need to speak up about the importance of public health. Um, I think we all realize that public health is in a pretty challenging position right now. And we work with organizations and people to make sure they have the training and the tools they need to educate the public, community leaders, elected officials about how important this stuff is. Can hit the next. Yeah, so this is kind of our why, and I'm not going to read everything on the screen. And for me personally, Um, I was a health director in South Carolina for years and then worked at the state health department in Georgia for a couple of years as well. And what really drives us and drives our volunteers and drives the work that we do is our system is incredibly stretched right now and struggling and getting worse. And I've seen a lot of questions about how these Medicaid cuts and the Affordable Care Act subsidy lapse may impact folks, but the future looks pretty bleak unless we start to make some pretty significant changes to how we do things. And the reason we need to do this now is because those federal resources are fading. States, particularly in the South, have been very, very, very dependent on federal dollars for a long time. To sort of boost up their local health departments. It varies from state to state, but to give you a really extreme example of this, only about 10% of the dollars in the state of Mississippi for their health department come from state and local government. 90% is coming from the federal government. So our role is to make sure that we give local leaders the resources they need to be effective. So we do trainings on effective advocacy tactics. We give folks lots of great data about what the sort of public health measures look like in their community. We help them figure out who the folks are that they need to be talking to locally. And we also think about what actual solutions are to some of these issues, not all of which require necessarily state level policy change. And Representative Lim's point from before is really important. Engaging with your local school board, your city council, your county commissioners, like all of those folks play an important role too. And so right now we're working in 4 states in the South, North Carolina, South Carolina, Georgia, and Tennessee. And we have 20 counties that we're targeting around the MMR and DTaP vaccine. And these are counties with particularly low vaccination rates. The DeKalb County is not one of those counties, but because DeKalb County is near and dear to my heart, and I'm a resident of DeKalb County, and we have also received a little bit of funding from the DeKalb County government. We are doing some work to try to increase to increase vaccine uptake in South DeKalb in particular, and we'll talk a little bit about what that looks like. So our long-term success in all of this, because this is long-term, we're our health system, our public health system took a long time to get to where we are now. And it's going to take a long time to dig it back out. But our long-term goal is to really preserve the good public health policies we have, but also not to be completely reactionary. We have to find positive new solutions to some of these issues, and find ways to move forward, so that we don't have measles outbreaks in our communities, so that people's hospitals aren't closing, so that nursing homes aren't closing, so that caregivers have what they need to support their family members. And bringing this work to DeKalb, and then the map is a little bit small on here, but what this is showing you is the lighter the dot is on that map, the less likely the folks in that zip code are to get their kids vaccinated or to get vaccinated themselves for adult vaccines. And oh, can you go back one for me? So, um, you know, in Gaines County, Texas, where we had the really significant outbreak of measles, the vaccination rate for the MMR in that community was 82%. DeKalb County's is 88%, which is obviously higher, but it's not high enough to prevent a measles outbreak. I think the really important point from this map is there are pockets of folks who have vaccination rates much lower, and that puts us all at a much greater risk of those communities having some kind of significant outbreak. So what we're doing around this work is identifying what some of those gaps are, and making sure that all of the sort of service provider oriented organizations, whether that's community-based organizations, faith-based organizations, daycare providers, schools, whoever it may be, that they have the tool set they need to have effective conversations about why vaccines are important for their kids. And this is specifically targeting sort of South DeKalb, and there's a link through in here to the analysis we did that sort of tells you a little bit about why we landed here. So this is maybe one of the most important points, at least for me, about all of this. And again, I'm not going to read all of the text on here, but I think one of the big takeaways for everybody should be that there are not simple solutions to a lot of these issues. There are very real challenges, in particular with how people access care. The reason that our vaccination rates look the way they do isn't because everybody has suddenly fallen in love with RFK. I know that's an easy out, but a lot of what we're talking about here are communities who have issues with access to care. Their children have access issues, don't have a primary care provider, aren't getting that yearly well visit. And so they're huge challenges for how they're getting into care. And have other priorities they're dealing with, like unstable housing, access to food, all of these other issues that sort of create challenges. And so it's really important to continue to think about how you can address some of these challenges, acknowledging that, for that parent, there are a million things they're dealing with, and vaccines are maybe a priority on a very long list of things. All right. And I would really encourage folks to reach out if they want to learn more about this. We've been very focused around vaccine work thus far, but we are starting to do a little bit of work around Medicaid cuts, which I know is something that people are really interested in, and how they may impact health departments. And we're also starting to look at what an agenda might look like around addressing infant and maternal mortality in the state, which is a huge problem in Georgia and a huge problem across the South. But we're really excited about the work that we're doing, and excited to answer some questions in a few minutes too.
Okay, wonderful. Thank you so much, Scott. And yeah, if you guys will be looking in the chat, there will be links to these and their emails and their websites and all that. So please be on the lookout for that. But I'm going to go ahead and turn it over to Toby if you want to get started.
Yeah, awesome. Thank you, Melanie. And thanks everyone for being here tonight. And thank you for having me, Representative Lim and Scott. Thank you so much for your presentations. I feel like this is a great segue into the topic that I'm going to be talking about, which is kind of the landscape of U.S. healthcare post the Affordable Care Act and what the One Big Beautiful Bill Act really does and what it means to us now and how we can get involved in advocacy efforts in fighting back. Go ahead. So this is data from 2021. And I think it's important to set the stage to say, like, where were we before the Affordable Care Act kicked in? So the Affordable Care Act kicked in, or was signed into law during President Obama's first term. Most of the effects of it weren't felt until his second term, so 2014 and on. But we see once Medicaid expansion and the Affordable Care Act subsidies went into place, we had a pretty dramatic reduction in the number of uninsured individuals. The reason why I want to set the stage for this is because much of what we're seeing in the One Big Beautiful Bill Act is watering down some of the provisions in the Affordable Care Act. So we can expect kind of over the coming years, we are going to trend back up towards the previous uninsured rate prior to the ACA. Next slide. And I mentioned the two main provisions that led to a decrease in the uninsured rate after the Affordable Care Act were Medicaid expansion and the Affordable Care Act subsidies. Um, Originally, every state was going to be mandated to expand Medicaid. To Representative Lim's point, this is where the Supreme Court came in and basically ruled that the federal government could not mandate that. So we've seen over time more and more states expanding Medicaid because it makes sense to do so, both financially for the state and for the health of the population. However, there have been some holdouts, and as I'm sure everyone on this call knows, Georgia is one of the 10 states that has not expanded Medicaid. Next slide. You're probably going to hear a lot in the coming weeks, months about, and probably already have about the enhanced premium tax credits or the ACA subsidies. This slide kind of just compares and contrasts what these looked like in the original ACA and then in 2021 when President Biden signed the American Rescue Plan Act, which put into law these enhanced premium tax credits. So in the original ACA, the tax credits were much less favorable, and the subsidies were completely eliminated if you made or if your family made over 400% of the federal poverty limit. The American Rescue Plan Act enacted stricter caps on the amount of premium that folks were able to pay. So this is as a percentage of their annual income. And it also put a cap on folks who make above 400% of the federal poverty level and allowed them to get the tax credits and the premium subsidies from the marketplace plans. Next slide. And here in Georgia, just looking at what our healthcare coverage landscape looks like, we, like most of the country, have the majority of our folks get health insurance through their employer. The next biggest payer in Georgia is Medicaid, followed by Medicare. And actually, the next biggest payer is self-pay because the next biggest proportion is the uninsured. You can see down in the bottom, about 7.3% of the population do get their health insurance through the marketplace plans. And then we have a smaller proportion who gets it through the military. You can click. And really, what is being targeted is that Medicaid and the marketplace plan. So that's really the sliver of the pie that is going to be affected by the One Big Beautiful Bill Act. Next slide. So let's talk a little bit about what this act does. Next slide. So one thing that it doesn't do is it does not extend the enhanced ACA subsidies. And so, when I had that table a couple slides ago, we're going to see that those subsidies return to the pre-ARPA levels. So people above 400% of the federal poverty level not going to be able to get the subsidies, and folks who fall below the 400% poverty level may get a subsidy, but it's not going to be as favorable. It also ends certain protections against Medicaid disenrollment and protections to promote Medicaid renewals, in particular in the elderly and those with disabilities, but also for children who lose their Medicaid because of missed payments. The Biden administration had put bans on lockout periods. This bill is going to end that. So those are some ways that it's going to affect the number of people on Medicaid. It also bans new immigrants from getting access to the marketplace plans for 5 years. They're already banned from Medicaid for 5 years. And then specific to the Medicaid expansion population, it's going to impose work requirements, make it so folks have to renew or prove eligibility to Medicaid twice a year, as opposed to typically it's once a year. And then it's going to increase copays or add copays, and Medicaid traditionally has little to no cost sharing. There is something called a provider tax loophole, which is a way that states get extra federal funding for Medicaid. It's also going to put a cap on that and eventually phase it out. Next slide. So this is a timeline. This is something that Senator Warren posted on her socials. But you can see that actually a lot of the provisions of this bill don't go into effect right away. The first thing that we're going to start noticing is that the enhanced ACA subsidies are going to sunset. And so that as people enroll during open enrollment this fall, they are going to have the higher subsidies come January 1st. The Medicaid work requirements are going to start in 2026 and fully kick in 2027, along with the other Medicaid reporting requirements. So much of the effects of this are going to be pushed past the midterm election, meaning that this is a really ripe area for advocacy and for public education during the midterm season. Next slide. And here in Georgia, we can expect to see an increase in the number of uninsured by almost 750,000. We can also expect to see about $2.3 billion over 10 years less coming in from the federal government for Medicaid funding. That total number is going to be about $10 billion when we look at the entire impact of the bill, $10 billion less of federal funding to Georgia. Families are going to be spending a lot more on the ACA premiums, and we're going to see a lot of healthcare facilities that are at increased risk of closing. Next slide. Here's a look at counties that have hospitals, nursing homes, Planned Parenthood, and other healthcare providers that are at risk of either shutting down some of their services or closing altogether. Next slide. And if you can see, the pink counties here have rural hospitals that are at high risk of closing based on these funding cuts. All of this comes from the Georgia Recorder journalist Maya Homan. She's put out some really great content, so I recommend you check her out. Next slide. All right, so I want to end a little bit more upbeat. So what can we do to kind of fight back against some of these changes? Next slide. And I'm actually going to skip over this just for the sake of time. So let's go to the next slide. So there's this group called Physicians for Medicaid. They've been organizing a lot of actions around the country, kind of in support of protecting Medicaid and in opposition to this bill. Here are 3 QR codes, one for physicians, one for patients, and the other just if you want to see kind of what they're doing, forward it on to other folks. It's a really great group of people that I've been lucky enough to be involved with, and I think they're going to be increasingly important as we continue this fight. Next slide. Here in Georgia, Georgians for a Healthy Future and Cover Georgia are the organizations that for the longest have been working to protect Medicaid and really to expand Medicaid in our state. So if you are not yet on their listserv, I recommend joining. It's how I get a lot of my information about Medicaid in Georgia, and I think they are going to be leading the charge kind of to protect healthcare coverage in Georgia. Next slide. And then the institution that I identify with most closely is called Physicians for National Health Program. It is a single-payer universal healthcare advocacy group, 501c3. But right now, given all of the kind of threats to federal funding of healthcare, Medicaid and the ACA protections are kind of top of the mind. And so I was involved in some advocacy through Physicians for Medicaid that got promoted through Physicians for National Health Program. If you want to learn more about us, here's the QR code. And then the final slide is an op-ed that I published with a couple other Atlanta physicians who were organizing and protesting the passage of this bill. Unfortunately, later that day was the day that it did pass in the Senate. But we're trying to be out here doing the good work, and there are a lot of ways to get involved. So with that, I'll conclude my presentation so that way we have the last 10-15 minutes for questions.
Okay, thank you so much. And I'm going to stop sharing my screen real quick while we get to these questions. I'm going to ask the questions, and also everyone, I'm going to put all of those QR codes that we just got from Dr. Terwing. I cannot, Toby. My tongue is just not doing it today. So I'm gonna put all those in the chat, but I just want to go through some of these questions, and the panelists will be able to answer these for you all. And if we finish them in time, we'll take more questions from you all. But someone asked, as a ACA recipient, I would like to know how much the cuts will affect healthcare access for people like them. That was one of our first questions, so I'll leave that open to the three of you. Take a turn. I know Toby had a response to this.
Yeah, so this is a really great question, and it's a little bit hard to know. I will drop a link in the chat in just a second that the Georgia Budget and Policy Institute put out that kind of will help to estimate like what the effects on you personally will be, because it is going to depend a little bit on if you have like where your income falls in regards to federal poverty level, right? So if you make more than 400% of the federal poverty level, the subsidies are going to end for you. Most people will continue to receive their subsidy. It's just most likely that the premium is going to be higher, so they'll get a lower subsidy. But I will go ahead and drop a link to that like estimator in the chat.
Okay, great.
Something I wanted to add quickly to that is part of what's happening here is the policies are intentionally put in place essentially to deter more people from signing up. And if you have never walked, I was on the marketplace once. If you've never walked through like the user experience of what that is like, I mean, you can probably guess just if you've done anything besides physician employer insurance. These are onerous things to begin with, perhaps legitimately so. But because these are intended to raise the barrier, those that have options, other options, are more likely going to use those options, which means those that have fewer options, those that then, as a corollary, will likely be sicker. That will just make it more and more expensive. And so, again, this is an attempt essentially to go the other way of ACA, which is to privatize more things, which will make it more expensive for everyone. It'll also obviously make everyone sicker. But I think thinking through what, even there's not a dollar amount to that, what bureaucracy is able and not able to do in terms of shaping people's behaviors. And again, especially for traditionally disadvantaged populations, is critical for points of advocacy.
Okay, great. And the next question is, can you explain how the changes to Medicaid eligibility rules will reduce Medicaid coverage for Georgians? And I know you guys went over that a little bit in the slides, like very, very briefly there, but if you can expand on that.
Yeah, so and sorry, I don't want to monopolize, but I can take this one also. So for better or for worse, Georgia is going to be a little bit less affected in terms of Medicaid from this bill because we have not expanded Medicaid. Most of the Medicaid provisions, most but not all, are specific to the Medicaid expansion population, which we do not have in Georgia. So It is going to be a little bit harder for people who have Medicaid to stay on Medicaid because some of the protections that the Biden administration had put into place are going to be removed. But for the most part, the majority of insurance loss in Georgia is going to be related to the subsidies and not related to Medicaid.
Okay. Anybody else want to add to that at all? No? Okay.
I would just add that, for we're working in North Carolina too, and it's hard. Like this is not a good situation for Georgia, just to be very clear. But North Carolina could have as much as 1 million people drop off of insurance because of provisions in their law that effectively drops the expansion with any cuts to funding from the federal government for the program. And I just this is all really bad, but it's not quite as bad in Georgia.
The one thing I'll
Okay.
quickly add there is, okay, so what do we do about it, right? The It's hard unless people have either been directly affected or hear about it from someone else to internalize what the impact of all of this is, which is why stories really matter, and which is why, the bad side, obviously, nobody wants any of this. Well, we don't want any of it, is a lot more people are going to be impacted. The kind of the better part of that is like, okay, there are more stories to be told. There are more ways to put a face to the harm and thus create more accountability by those that are seeking to implement these changes. So I think that's the other thing or one of the other things I would think of is like, okay, this is bad. I think we're obviously this is horrible. How do we fight back? Talk to people about it. Listen to people when they're telling you their stories. Encourage people to tell their stories because there's going to be a lot more of that stories.
Yeah. Yeah. And expanding that out makes it more real for people where they really can get a grasp on that, I think. All right. And can you explain how the changes to the Affordable Care Act marketplace will worsen Georgia's nation leading uninsured rate?
Scott, do you want to take this
Yeah,
one?
I can take a little bit of this. I know we've talked a lot about Medicaid cuts and I'm gonna come up with another name for it, but the big beautiful bill. The subsidy lapse that's gonna hit at the end of this year is in a lot of ways just as scary. And particularly for folks who fall in what's called that federal poverty level between 100 and 250% are really going to get hit hard by premium increases. And, for an individual, they will likely see an average increase of something like $500 a year. And that's for an average. And there are counties in Georgia where it will be twice that. And so I, you know, everybody will have to figure out and use a calculator to figure out what their specific rate is and what that'll look like. But uh, nobody's going to see a lower number. I can promise you that. And so I do think to Representative Bloom's point, I like collecting those stories and also talking about the economic impact of what this is doing is really important because it's these hospitals closing, it's these nursing homes closing, it's also all of the businesses that support those organizations too. And for many rural communities, that hospital is the largest employer, almost certainly the largest employer of college educated individuals. And it will be devastating for these communities. And you can look at what it's done in communities where hospitals have already closed. So really, really important that we continue to sort of tell people about what's happening with this, and not lose track of those stories of individuals and communities that are impacted by it.
Yeah. Yeah. And push them out as much as possible. Okay, I'm gonna jump to the next question if everyone's okay with that. So, what are the enhanced premium tax credits, and why will ending these affect the number of Georgians receiving health insurance?
So this is what we've been talking a lot about. So the enhanced premium tax credits are the enhanced subsidies that went into effect in 2021 as part of the American Rescue Plan, so the ARPA. And so basically, they have a sunset clause where at the end of this year, they're going to sunset if Congress does not renew them. And the reason being is because people above 400% of the federal poverty level will essentially like be phased out of it. And then folks below the 400% federal poverty level will have a harder time renewing or enrolling because they're going to shorten the window of enrollment. They're also going to make it harder for people to auto enroll. So if you have it one year, it's going to be harder to auto enroll into the next year. And because the premiums are going up, there will be some folks who decide that they no longer can afford to have it. So for all of those reasons, there are a handful of reasons. Georgia has done a really nice job rolling out our online marketplace. Portal, and it's going to unfortunately undo a lot of the gains that we've made there.
Okay. And yeah, I just want to just real quick before we get to these personal ones we just got here. I just want to answer what is the state provider tax and how will changes to it affect the Medicaid program in Georgia, real quick, and then we'll grab these.
So this is a really kind of complicated topic. I'm going to try and make it as simple as possible. So basically, states are able to charge hospitals, nursing homes, providers, ambulance services a tax. This tax is really more of a rebate because what they do is they end up paying the hospital more than they normally would. So let's say they were going to give them $1,000. Now they're giving them 1030. All right. Then they're collecting that $30 back in tax. So the net payment is the same. And this is an oversimplification, but this is essentially what they're doing. So the net payment is the same, but the payment that the federal government sees is greater. So now the federal government is providing a matching dollar value based on an inflated value. So it is a loophole. It is a way that states are essentially kind of like conning the federal government into giving them more money. But every state does it. Alaska is the only state that doesn't use this provider tax. And it's something that states have relied on to fund Medicaid for a long time. So that's essentially what it is. It is a way that the states are just able to get more federal dollars into the state Medicaid programs. And unfortunately, it's going to lead to a lot of states having some significant budgetary issues because this is money they've relied on.
Okay, and then I'm going to wrap these last two into one. They both have to kind of do with Medicaid. So, are there plans for navigation programs that might help patients sign up and retain Medicaid and ACA, and would specifically Alzheimer's patients in LTC be affected by Medicaid approval?
I mean, I would say one thing that's really, really important about all of this is every person's situation is going to be different. And so like this stuff is complicated enough that like you're gonna many people have to check with like an insurance broker or something just to figure out what kind of coverage they're gonna qualify for. That said, if say somebody is already collecting on Social Security, if they're already a senior and on Medicare and have spent down their assets, which is a whole conversation for another day about how Medicaid works for seniors. That population is still going to remain covered under what we're talking about here, and work requirements would not be applied to that population. But again, it's going to be independent on the individual, and they're going to have to do some research to figure out what that looks like.
Yeah, and just to also plug on that real quick, I know Rep Lim is gonna jump in here, but there is on his website. I'm sure you're gonna talk about this. Some resources. Go ahead, Rep Lim.
Oh, I
Oh, I saw you kind of like jump, but I was gonna say if you're not
I had a question. Toby might be able to answer. And Scott talked about brokers, right? Um, obviously, when the ACA came about, they created essentially navigators. I forget yeah, they were called healthcare navigators. They still technically exist, unless someone correct me if I'm wrong, but there are not that many of them, which I think is why when I said earlier, when I say, help isn't coming, it's not that, there aren't people making to work it. It's that because that shockingly, efforts to repeal ACA do not include itself a navigator with it. And all of this federal funding is going to get cut. It is really up to the communities. And so I'm very curious what our local health departments are going to do, and what other, even not healthcare specific, but nonprofit organizations. I think of folks that are in DeKalb, like the Latin American Association, or again, some of the FQACs. How First of all, how they're going to have to navigate this from a regulatory and financial standpoint, but also how are they going to, with more limited resources, help others navigate this? There is not going to be a great solution at all, but that is where hopefully some of the community can come in, because I'll say this one more time. Even before, this was already hard for a lot of people. It is hard to navigate this. One of the points of advocacy that we've been toying at is Gateway. Gateway is the system used. It's run by our Department of Human Services. It's basically how you apply for everything from SNAP to Pathways is now part of that. To CAPS, child care assistance programs. And it is very hard to navigate. And they ask for all of these documents. That's only going to increase more. We should and absolutely will push back against the policy. But in the meantime, what can we do as communities, even neighborhoods, to help those that are struggling with that? Because obviously they're the ones that are going to be the most impacted. What can we do about that? That is the question I would pose to you all.
One one just quick plug on this I would also make around these issues is, as we've also seen grants pulled back from the federal government, a lot of those grants were a lot of that COVID money, for example, was sort of an infrastructure money that lots of organizations were starting to use to resolve some of these issues. So trying to create more connectivity between systems like Gateway and local health department, EHRs, and school record systems so that all of these can be talking to each other a lot better than they are now. And a lot of those plans are on hold, either because the funding's already been pulled back or folks are really worried about what might be coming in the future.
And if I may, in 10 seconds, also, what can we do? We're talking a lot about government, but there was a lot of expectation last year. I mentioned I also have a nonprofit that private philanthropy would step up with all of these cuts coming, in part because of the threats to private philanthropy from the Harvards of the world to going after nonprofits in their C3 status. There are a lot of folks that are very scared about that. So I think, so what can we do? How can we push the environment around us, other corporations, our businesses, even if it's in small ways? Can we push them to step up? Because either these services won't exist or they will exist in some form just funded by someone else. So it is not even always just the government whom we can advocate. It is these other private entities as well. Okay, so
Yeah.
that was 40 seconds. Sorry, Melanie.
No, you're great. And that's something I really want to urge everyone who's on this call. And if you're watching this later, this is a key point. Go look at Representative Lim's website. It's in this chat here, marvinlimforga.com, and just understand the reason why I wanted him and these other wonderful wonderful people as panelists on this is because we should be pushing the people who are doing things to connect and collaborate and see where we can fill these gaps. And I think that a big reason why a lot of times we might not see like other legislators maybe tapping into this stuff is because they're not connected in that way, or they don't know that they even can have access to these resources or have access to doing things that we can kind of, like I said, fill those gaps. So please do reach out to your personal representative. Rep Lim is from Gwinnett, but do reach out to your legislatures and let them know they can do this. And if they want help doing it, like I said, we're all going to collaborate. Everyone on this call is here to not have any ego in any way and just help each other so that we can make a difference for people, because I know that's why we're all here. We care deeply. And I appreciate all of you. If there were any other questions, you can email me directly. It should be right back to that Mobilize link, or get in touch with us through one of these either emails or phone numbers or whatever it is, whichever contact you prefer. We will make sure we get back to you. But thank you so much, everyone, and share the recording with your friends, please, and the messaging.
Thank you, Melanie, and go DeKalb Dems.
Great job, everyone. Okay.